Ji Jinghai from the Comprehensive Business Department of GACC, and Director General Liu Haitao from the Border Inspection Department of NIA, Inspector Jin Junhao from the Transportation Department of CAAC, to take questions on the strengthening of imported case prevention, landway ports control, and chartered flights by the civil aviation. First, some updates on the pandemic in the 24 hours of April the 12th. According to reports from provinces, cities, and Xinjiang Production Construction Corp, new confirmed cases 108, including 98 imported cases. They were in Heilongjiang, 49 in Heilongjiang, 35 in Inner Mongolia, 11 in Shanghai, 1 in Tianjin, Shanxi, and Jilin, respectively. 10 were domestic cases. 7 were confirmed in Heilongjiang province and 3 in Guangdong province. New deaths 2. Both were Hubei cases. New suspected cases 6. All were imported cases, including 4 imported cases in Inner Mongolia and 2 imported suspected cases in Shanghai. On the day, newly cured and discharged from hospitals 88, close contacts that have been removed from medical observation 1,092, severe cases were reduced by 18. Some updates on the imported cases. Remaining confirmed cases 867, including 38 severe cases. Remaining suspected cases 72. Cumulatively confirmed cases 1,378. Cumulatively discharged from hospitals as cured cases 511. No death case among imported cases. As of 24 o'clock, April the 12th, according to reports from provinces, cities, and Xinjiang Production Construction Corp, remaining confirmed cases 1,156, including 122 severe cases. Cumulatively cured and discharged from hospital 77,663. Cumulative deaths 3,341. Cumulatively reported confirmed cases 82,160. Remaining suspected cases 72. Cumulatively traced close contacts 719,908. Close contacts that remain under medical observation 9,655. In Hubei province, on the day there was no new confirmed case, no new or remaining suspected cases. On the day, newly cured and discharged from hospitals in the province 57, new deaths 2. Both were Wuhan cases. Remaining confirmed cases in the province 244, including 243 in Wuhan, in which severe cases were 75, including 74 in Wuhan. Cumulatively cured and discharged from hospitals 64,338, including 47,186. Cumulative deaths 3,221, including 2,579 in Wuhan. Cumulatively confirmed cases 67,803, including 50,008 in Wuhan. Provinces, cities, and Xinjiang Production Construction Corp reported new asymptomatic cases 61, including 12 imported asymptomatic cases. On the day, 28 were transferred to the confirmed case category. All were imported cases. 55 cases were removed from medical observation, including 9 from imported cases. there are still 1,064 asymptomatic cases that are under medical observation, including 307 imported asymptomatic cases that are under medical observation from Hong Kong, Macau, and Taiwan. Cumulatively reported confirmed cases 1,437, including 1,004 in the Hong Kong SAR, 45 in the Macau SAR, and 388 in the Taiwan region. On April the 12th, domestic severe cases for the first time were reduced to below 100. Domestic new confirmed cases was 10, highest since March the 31st. Most of the cases belonged to cluster cases, according to the latest report from WHO. Global deaths have exceeded 100,000 for 4 consecutive days. Single-day confirmed cases have exceeded 80,000. Prevention of domestic revival and imported cases are faced with mounting pressure. We should never slacken our efforts. This has been the updates. According to the needs of the prevention at Suifenhe Port, in Heilongjiang Province, NHC has organized an experts panel to Suifenhe. In this experts panel, there are health administrators and also the ICU experts, lab and tests, epidemiologists, and the lab technicians. Some of them have just completed their support in Wuhan and Hubei province. They are collaborating with the local authorities to prevent the further transmission. National Health Commission will, in light of the changes of the situation, dispatch people to support relevant and pertinent localities. Now, we would like to open the floor for questions. Please ask questions on today's topic, and please identify yourself before you ask your question. Journalist from the first row on the right side, please. Thank you. With Xinmin Evening News, as we see increasing pressure of imported cases, many of the general public have profound concern of port inspection. These inbound travelers need to go through NAT tests. In the new confirmed imported cases, are they from the inbound travelers on the day or from previous inbound travelers? DG Wang Bing is taking the question. Thank you for your question. We now have a precise classification and a risk-zoned approach for managing inbound travelers. For 4 types of inbound travelers, and the confirmed cases, suspected cases, and the inbound travelers with symptoms such as fever, these 3 types of inbound travelers will be immediately delivered to the health institutions, and they will go through NAT tests for confirmation. And for their close contacts, we have 14 days of quarantine, mass quarantine for medical observation. During these 14 days, if they show some symptoms, they will then immediately sent to designated hospitals and health institutions for further screening. And for the non-full type inbound travelers at the point of entry, we will have a 14-day medical observation. During this mass medical observation period, these people can voluntarily take lab tests, but the fee will be on their own. From the 3rd day, 5th day, they can get NAT tests twice. And on the 5th day of their mass observation, they can also have IgM antibody testing.
If all of the 3 kinds of tests show negative, then they can choose to go back home and stay at home for the 7-day quarantine. Thirdly, for people outside the above-mentioned 4 kinds of people, if the medical institution believes that they are also risky population, then they need to have the 14-day centralized medical observation after the 2 NAT tests. And there should be 24 hours in between. And if both of the tests show negative, then the quarantine can be removed. For the newly increased imported cases, whether it is the imported case on the exact day or the previous ones, we are working on the analysis. As you know, all the imported travelers, I mean the inbound travelers, are under our monitoring according to the law on infectious disease. And some of them are identified on the day when they arrive, while the others develop symptoms during the quarantine period, and they are confirmed and reported. They represent over 70% of the cases identified. Okay, let's continue. On the left, on the front row, the first reporter, please. Thank you. National Business Daily. The leadership team points out that for asymptomatic infection, there should be intensified screening and monitoring, and they pose a growing risk. So what are the measures adopted by the customs authority? We will have Mr. Jin Hai to take your question. Thank you for your question. For asymptomatic infection, indeed, it has posed a greater challenge in the border control. The customs authorities have intensified the relevant countermeasures in the entry points by air, by land, and by water. We have strengthened the efforts. First of all, we have increased the number of targets for epidemiological survey. We bring into full play the role of the health declaration form and the epidemiological survey in identifying the asymptomatic infection among the high-risk populations. For different groups of people, we follow different approaches which are tailor-made, and we focus on the history of contact or exposure. For people who used to stay or travel in the highly affected areas 14 days prior to the inbound travel, we will intensify the monitoring or the screening efforts to identify the risk and make detailed record of the whereabouts of the targeted people and also their close contacts. By doing so, we wish to eliminate the potential risk and to have a detailed investigation, to have successful screening. And second, we have increased the testing. Starting from April the 1st, the customs authorities have expanded the NAT coverage to all the inbound travelers, maximizing the testing on the inbound travelers. This facilitates the early detection, early finding, early reporting, and early treatment. The customs authorities have adopted the swab tests and also other ways to collect samples for the tests. In customs offices with available conditions, the serological tests are also conducted to maximize the probability of tests. Also, in some localities, two kinds of tests are conducted to complement the result or confirm the result. Also, thirdly, we have intensified the closed-loop management. The local Administration is asked to fulfill their duty, and the relevant government agencies are well coordinated to make quick response and information sharing. So the prevention and the control at the border or in the entry points are well integrated into the local efforts. Also, the customs authorities will transfer the relevant information to the respected government agencies and realize the closed-loop management. With the above-mentioned measures, we wish to intensify and secure the security network and monitor and identify the asymptomatic infection as well as other confirmed infections. We wish to curb the spread of the pandemic. Okay, thank you. Let's continue. Okay, on the left, the foreign journalist in T-shirt, please.
Reuters. Recently, there have been a number of ambassadors representing some countries in Africa that have written to the Chinese government complaining about ill treatment of people from Africa living in Guangzhou, saying that they have been subject to stigmatization and discrimination, including repeated testing, being evicted from apartments, and suffering harassment. I wondered, what's your response to this? What is the policy at the moment in Guangzhou with regards to this? The second question is about foreigners. At the moment, there's a ban on foreign residents in China, foreign residents who have foreign residency in China returning to China. Is there a plan to end this ban? If so, when? Will it be done country by country or city by city? And finally, along the same lines, there have been reports amongst some foreigners in China of different treatment. Is there a policy to treat foreigners differently at the moment? And could you explain the rationale behind this? Thank you.
好，请翻译一下问题。
来自路透社。有3个问题。第一个问题是，最近有多国的大使写信给中方，那么这些大使呢，主要是非洲国家的大使，他们提出，一些非洲的公众在中国生活的时候呢，受到了不公平的待遇，主要是在广州出现了这样的问题，出现了这个非洲人被歧视、被污名化的情况，而且呢，有非洲公民抱怨，在广州呢受到了多次的这个检测，然后呢，正常的生活也受到了干扰。那么，请问一下呢，对于这个情况，那么中方呢有什么样的回应啊？为什么在广州呢会有这样的情况？这是第一个问题。第二个问题呢是有一些外国人。他们之前呢在中国生活和学习，但是呢现在因为这个疫情，现在有一些禁令，使得他们呢无法回到中国来学习或者是生活和工作。所以我想请问，这样的禁令何时会被解除？那解除的话呢，是大概会在什么时间？还是会按照不同的国家区别待遇，然后或者是按照不同的城市有不同的这个解禁的做法？第3个问题呢，也是围绕着外国公民在中国的情况的。那么请问一下，为什么这些外国公民在中国会受到这些不同的待遇？那么他们的这个在治疗或者是在平常的生活当中呢，是否有受到这种不同的待遇？然后会如何考虑解决这样的情况？
好，我们先请王斌女士来回。
I'd like to invite Inspector Wang Bin to take the question first. Well, you've talked about the situations in Guangdong province or Guangzhou. As far as I know, the prevention measures adopted in Guangdong province is the same as that in other provinces for imported people. For inbound travelers, we have the 14 days quarantine, and their close contacts will be put under strict management as well. That's the same for all the inbound travelers in whichever province. So I believe the situations you've mentioned might be related to some of the preventative measures for inbound travelers. As to the life and work of foreign residents in China, and including the questions as to how they return to their own countries or come back to China, it depends not only on China's prevention and control efforts, it is also related to the pandemic control in other countries. I believe if the foreign nationals want to go back to their own countries, they should first have a proper analysis of their own country's pandemic situation and make their own choices. And for the third question, I think the prevention control measures adopted in China are equal on each and every, being it Chinese or foreign citizens. We have infectious disease prevention and control emergency response, and also we follow IHR. Regulations will be equally applied to each and every China's land, being it Chinese or foreign national, including the public health interventions, the grid management conducted by communities, and the treatment practices carried out by hospitals are equal among all those who are in China. Thank you. Journalist from the second row on the right side, please. Thank you. Southern Metropolitan News. Recently, there has been an increasing pressure of imported cases from landway ports, and this is of profound concern, given that we have 22,000 kilometers of landway ports. Then what are the measures adopted by NIA? DG Liu Haitao is taking the question. Thank you for your question. China borders with many countries, and the majority of these bordering countries have reported confirmed cases. The pandemic is still raging in the world. There is a mounting pressure of prevention imported cases from neighboring countries. As you have rightly pointed out, China has a long and winding land borders along the mountainous areas, the paths, the small ways, so the terrain is difficult. The difficulty in management is difficult as well. NIA has been strengthening our work deployment for the landway port imported case prevention. We've adopted the following measures. First, we minimize the unnecessary people movement, prevent the third country foreign passport holders to go through our ports of entry, and have a strict regulation over the issuance of visa, restrict the unnecessary movement because of the family visits or travel. The inbound and outbound traveler numbers have decreased by almost 90%. Second, we have strict management over the ports of entry pathways. For the closed ports of entry, the closure continued. The seasonal closure will also be continued, so as to forbid the people movement by using these ports of entry. We only keep the cargo transport function. We collaborated with other departments to guard these closed points of entry to prevent illegal entries. And the party leadership, we collaborate with the local governments, cadre, and the general public, and deploy police for the points of entry and some of the waterway entries. We've increased the number of rounds of inspection to prevent the illegal travels, including the drug trafficking. We've also identified some of the violators and the criminals. Fourth, we've also improved the advocacy of laws on the general public and encourage the general public to be the whistleblowers of violations and crimes. We collaborate with the Immigration Department of bordering countries and establish information sharing system so that the bordering countries will have consistent quarantine measures, and we will be engaged in joint efforts of cracking down on cross-border crimes. Journalist from the second row on the right, on the left side, please. Thank you. Shenzhen Satellite TV. I have a question for CAAC. There has been the decrease of international flights. Many overseas students find it difficult to come back to homeland. CAAC has said on previous occasions there would be chartered flights to take Chinese overseas students back. So what has been the progress? I'd like to ask Inspector Jin Junhao to take the question. Thank you for your question. We've noticed that there has been profound concern by the general public and the netizens as the pandemic is rapidly raging across the world. CAAC previously, under the deployment of the State Council, made a decision to adjust the number of international flights, but we've still kept international flights with 61 major cities. A total of 134 back and forth to and fro flights. And also the State Council Joint Prevention Control Mechanism made further deployment that in destinations where there is stranded passengers and the needs for transportation and the travel is high, we've organized some flights to help overseas students to come back to motherland. In March, CAAC has arranged 9 temporary flights to fly back overseas Chinese in Iran and Italy, a total number of 1,164, including overseas students and also members on the joint work team as medical teams working in these countries. As of 4 o'clock today, when in April we have flown 7 temporary international flights to fly back overseas Chinese from US, Italy, Spain, a total number of 1,728, including 1,067 overseas Chinese students. And down this line, CAAC will continue to follow the integrated arrangements by the State Council, will collaborate with Ministry of Foreign Affairs and National Health Commission and initiated the flight services in an orderly manner for those who are faced with difficulties and who are stranded in overseas countries. We will help them to fly back to China.
Also, I would add that the civil aviation authorities have already worked out the latest technical guideline, and the airlines have already adopted the measures accordingly. However, recently we found that in the long-distance travel back to China, the local ground transportation and during the transits, there are a lot of risks. So in the light of the current experience against the pandemic and the advice from the medical experts, we suggest these overseas Chinese students and their parents to take full consideration the local conditions and their personal conditions, and take a prudent and science-based as well as a calm manner towards the question of whether to come back or not. Okay, let's continue. On the left, on the third row, the gentleman reporter, please. With People's Daily. Recently, in the Suifenhe entry point, there are quite many imported cases, which has aroused great concern. The city is quite small, with only dozens of thousands of population. So how to strengthen the capacity building in the local government and deal with the imported cases? We will have Madam Wang Bing to take your question. Thank you for your question. Indeed, just as you have pointed out, at the moment in northeast China, represented by the Suifenhe entry point by land, we are faced with a mounting pressure. These border cities are the first defense line against the overseas importation of the pandemic. Just as many people and many journalists are concerned about, these border cities are not so adequately equipped with the capacity to deal with the pandemic importation. At the moment, the pressing task is to improve their prevention and control capacity. These capacity include the capacity in the customs authorities, the various agencies, capacities involved. So in recent weeks, we've done the following efforts. First, we request the local governments to honor and fulfill their duties. These border cities, inland, and the local governments, as well as their provincial governments, should coordinate their local resources and strengthen the joint prevention and control. Also, they should make good coordination with the medical resources in order to deal with the potential increased risks. Second, just as DG Mi has mentioned, at the national level, we've already dispatched expert teams. At the provincial level, there are also expert teams and leading teams dispatched to these inland border cities. The local border cities, the governments are helped or assisted with the relevant capacity building. The capacity building covers many aspects. The efforts are made to achieve a seamless connection and coordination, as well as closed-loop management. The third major effort is that, in the light of the local needs, the central and the provincial governments are mobilizing and coordinating the required medical resources, as well as the pandemic prevention and control supplies, so that in a fairly short period of time, the local capacity can be enhanced to guard against the risks. Okay, let's continue. On the right, on the third row, the First Lady reporter, please. With CCTV, my question is about the export of medical supplies. As the global pandemic is getting serious, the export of medical supplies from China to other parts of the world is on the rise. Recently, the three ministries jointly released a policy circular, as well as the number 5 circular issued by the GACC, have guided the export of medical supplies. So specifically for GACC, could you please share with us some examples or cases in boosting the export of medical supplies? We will have DG Jinghai to take your question. Thank you. In the special moment of pandemic control and regulate the orderly export of medical supplies, better play our role and contribute to the global pandemic control and efforts, the GACC has earnestly implemented the CPC Central Committee and the State Council's instructions. We support the qualified and eligible companies to export their products so that the medical supplies qualified can be exported to the world. And we are trying to create an enabling environment for such export. Now, in the light of the global needs for pandemic control, you may see that the medical supplies produced by Chinese companies and enterprises are exporting to different parts of the world, providing a strong support to the global efforts against the pandemic. Last month, the GACC altogether cleared the customs for 16.5 billion RMB worth of medical supplies export, which is an important contribution to the world efforts against the pandemic. It is also a good indication of China's responsible manner to honor its role as a major country in the world. The Chinese government has attached great importance to the export of medical supplies, and we have strengthened the regulation over the sound export of medical supplies. We have identified and blocked the export of poor quality medical supplies, and altogether 3.3 million pieces of such poor quality products were identified and banned from export. Also, 590,000 protective gears with poor quality are not allowed to export. For ventilators, 677, and infrared thermometers, more than 4 million pieces. So a large amount, the poor quality products have already been banned from export. Also, the GACC has utilized platforms, online platforms, to expose such malpractices. Also, to facilitate the orderly export of medical supplies, following the relevant laws and regulations, and also in consultation with the related government agencies, on April the 10th, GACC worked out the number 53 policy circular. This circular decides that for medical supplies such as protective gears and surgical masks, as well as products which are relevant with people's health and the pandemic control, we will have the export inspection.
We will carry out the law-based inspection, and businesses, when they are to export the medical supplies, they must honor the obligation of truthful declaration for the substandard, falsified, or adulterated products or supplies, and substandard products and practices will be held accountable. They will be penalized, and the products will be under seizure. once there is the constitution of crimes, criminal accountability will also be pursued. For the truthful declaration and the law compliant enterprises, they won't have any difficulty in going through the customs clearance. The GACC will continue to provide customs clearance facility, but we will expose the wrong practicing enterprises, and in the future we will increase the frequency of inspection over the blacklisted companies. We'll have multiple departments to be notified so that the lawbreakers will be discredited. Thank you. Next question, please. Journalist from the third row on the right side, please. Thank you. With CRI, we've noticed that NIA has made great deployment in cracking down on illegal traveling across the borders. What has been the effect of the recent policy initiatives? I'd like to ask DG Liu Haitao to take the question. Thank you for your question. Recently, the immigration authorities at borders have strengthened their efforts in cracking down on illegal behaviors and have identified several organizational crimes. And the illegal behaviors, for example, the Yunnan-Guangxi border immigration authorities have identified 3 organized transfers. 4 organizations have been cracked down, and a batch of criminals have been identified, including those who want to go through the borders illegally. And the drivers of these human trafficking trucks and also the hotels who have been accommodating the illegal travelers have also been held accountable. I'd like to stress that the illegal trans-border travels have increased the imported risks. In order to improve the protection at the borders, recently NIA has made intensive efforts and focused on the illegal behaviors that happened at the borders. The lawbreakers have been held accountable and strictly dealt with according to the criminal law, Article 318. The organized illegal transfer of humans across the borders will be verdicted to 2 to 7 years of incarceration, imprisonment, and the gangsters or the head of the gangsters who have engaged in multiple transfer of illegal travelers, or with a big number of illegal transferred people, they may be sentenced to 7 years and above imprisonment, and their property will be confiscated or seized. I'd like to take this opportunity to give a solemn warning to all those who attempt to be engaged in such illegal practices and all those who want to be involved in the illegal transfers. All of you will be held accountable. Also, the general public who are living in border areas should fully understand the consequences of the illegal transfer of people. It may constitute increased risk of imported cases. Once there is a clue, the general public are invited to be the whistleblower. Let's join our efforts to protect a healthy homeland. Thank you. Next question, please. Journalist from the 4th row on the left side. Thank you. Hong Kong China Review. We've noticed that netizens have left messages in the CAC website hoping that there will be more cargo flights so that the overseas students can get medical supplies and pharmaceuticals sooner rather than later. What has been the progress? Inspector Jin Junhao will take the question. Thank you for your question. As the global pandemic is raging rapidly, in order to help overseas Chinese to safeguard their health and convey the love and care of our country and our party, CAAC has been following the specific deployment of the State Council and the Party Central Committee. We have been referring to the overall demand list compiled by the Ministry of Foreign Affairs, and we've initiated a program of delivering health toolkit to the overseas Chinese students. The first batch included 300 tons, a total of 300,000. All of them have been delivered. Later, 200,000 units have been added, a total number of 200 tons, and they will be delivered before 15th of April. So all the 500 tons of medical supplies will go to Italy, ROK, Japan, France, Germany, United States, Russia, and UK, altogether 20 countries and 59 overseas embassies and consulates, and they will distribute all these medical supplies and toolkits items to the overseas Chinese students. CAAC has been collaborating closely with the Ministry of Foreign Affairs and working on the delivery of the second batch of medical toolkits and toolboxes. The previous transportation of the toolkits have been impacted by the reduce of international flights. In this context, CAAC organized Air China, Eastern Airlines, and Hainan Airlines used the pure cargo flights and the auxiliary compartments of the passenger flights. Together, we leveraged the 33 flights and prioritized the delivery of these health toolkits. As CAAC adopted a combination of measures to improve the transportation capacity with limited flights, we are confident and more capable of ensuring an early delivery of the health toolkits to the overseas Chinese students. Thank you. Next question, please. Journalist from the fourth row on the left side. With CGTN, we know that for all the inbound travelers, we have 14 days of mass quarantine. If there is no confirmed case, no symptomatic case in an international flight, will the passengers on this international flight also be subject to 14 days of mass quarantine, or will there be other arrangements? I'd like to ask Inspector Wang Bin to take the question. Yes, indeed. In the cargo of prevention imported cases, we have very strict measures. We have 14 days of mass quarantine. Our goal behind this strict policy is to ensure safety from the point of entry to the doorstep, so as to control the first generation, the second generation, and terminate the third generation of cases. That's why we have the 14 days of mass quarantine. As to the question put forward by the journalist, for the international flights where there are no confirmed case, no asymptomatic case, all the passengers are subject to 14 days of quarantine. Is it an appropriate measure? The adoption of these measures are out of many considerations.
Mainly, first, in traveling into China, at the moment, we don't have access to the exposure history of the inbound travelers. That is, before the plane lands on China, prior to such inbound traveling, who has the passenger contacted and whether he or she is exposed to the contact risks. And secondly, we also need time to make the assessment whether this is asymptomatic infection or not. As you know, for asymptomatic infection, it is quite hidden and it is not subjective, so people may not perceive their infections. So we need time. That's why we have the centralized or concentrated quarantine to identify the asymptomatic infection. So we need such a period of time to ensure or to make the assessment and ensure that whether this is asymptomatic infection or this is infection-free. As I have mentioned, now we have about 70% of the asymptomatic infections who are identified during the centralized quarantine. So the centralized quarantine for 14 days is necessary and important. As for the tailor-made measures, we do have some alternatives, like apart from the 14-day quarantine, we can also ask these inbound travelers to take the voluntary nucleic acid tests on the 5th day and on the 3rd day, and also the IgM test. If all of the 3 tests turn out to be negative, then you can go back home and have the home-based quarantine. So we do enjoy some flexibility, but it is surely necessary to have the strict management against the potential pandemic importation. Okay, due to the time constraint, we can only allow 2 more questions, please. On the right, on the 5th row, the first lady reporter close to the aisle. Thank you. With Hong Kong Economic Herald, according to WHO update, globally, the confirmed cases have exceeded 1.6 million, and the pandemic has already affected hundreds of countries in the world. Now the international flights have been reduced. What are the measures adopted by the CACC to increase the transportation capacity, the cargo transportation capacity? Thank you for your question. Indeed, the pandemic has exacerbated the transportation. The Chinese authorities have rendered support to our best capacity. And we are under big pressure for the cargo transportation. In order to increase our transportation capacity and stabilize the transportation, the CAAC has set up a leadership team to ensure the cargo transportation. We have adopted 6 measures. The first one is to reduce the cost of international transportation. Previously, CAAC worked out 16 measures in 5 aspects, including the exemption of the airport development fee or charge, and etc. With these measures, for cargo transportation companies, their operation cost can be reduced. And second, we provide financial subsidies to chartered flights, for cargo chartered flights. And third is we have increased the efficiency. In early April, we worked out a policy notice to set up a green channel for the cargo transportation. The procedure is streamlined and the application process is shortened. Also, some procedures are streamlined, and we have initiated the online platform to accelerate the review and approval. Thirdly, we encourage the passenger air flights to use the previous passenger flights to have cargo transportation. By doing so, we wish to reduce the gap in the transportation capacity. And also, CAC has adopted new measures to offer more support to cargo transportation. So by April the 11th, we've already approved 656 flights per week for cargo transportation, and for cargo transportation, for the chartered cargo transportation, the approved flights number exceeded 1,000. Furthermore, to address the remaining problems, we support the related airlines to increase their flights to Japan and Republic of Korea for the cargo transportation. Furthermore, we facilitated the information sharing between the supply and demand. Starting from March the 27th, when CAAC worked out a policy notice requesting the airlines to set up special teams for cargo transportation. Then, on April the 7th, 25 airlines whose information about cargo transportation have been reported back to the authorities for further coordination. Also, we have initiated the air routes to guard against the potential breakup of the supply chain or the industrial chain. So the current arrangements have ensured the smooth transportation of cargo. And also, last week, about 98 airlines have already conducted regular cargo transportation airlines. This is an increase of 67%. And for all cargo transportation, it is over 1,000. And for passenger converted cargo transportation, it is hundreds of airlines. We've also approved more than 1,000 air routes application, which is 435% increase than the same period last year. For the next step, CAAC will continuously following closely the developments in the world and make a strong support to the smooth transportation in the world. And also, we will contribute to the enabling of the business environment as designed or as instructed by the State Council to improve our capacity. Okay, one last question. On the fourth row, the third lady reporter, please. Thank you. With China Civil Aviation News, we would like to know that on January the 23rd, Wuhan was locked, and 76 days later, the lockdown was lifted. The question is, what are the measures adopted by the CAAC to facilitate such a lift of lockdown?
Inspector Jin Junhao will take the question. Thank you for your question. Indeed, as you've mentioned, after 76 days of lockdown, approved by the Joint Prevention and Control Mechanism starting from 0 o'clock April the 8th, the Tianhe Airport resumed domestic flights. According to the specific deployment of the State Council, CAAC organizations have been ensuring the orderly resumption of domestic flights starting from the later half of February. The Epidemic Prevention and Control Committee under CAC has been collaborating with the airliners and the Tianhe Airport and studied on the resumption of operation plans. The airliners reviewed the qualification of the pilots and conducted examination on their qualification. The Tianhe Airport also made some exercises and drills. On April the 8th, the Middle and South Authority of Civil Aviation conducted on-site inspection to safeguard the resumption of operation of the Tianhe Airport in Wuhan. After the resumption of operation up till now, the airport has been running smoothly. The schedules have been followed. The order has been smooth, and all the work has followed the original schedules. Some data to be shared here from April the 8th till 12th. Total of commercial flights, 637 have flown in and out of the Tianhe Airport. The number of the flights were around 26% that of prior to the COVID-19 outbreak. Passenger throughput 31,000. The seating percentage 31%. Outbound flights 314 flights. Transportation of 17,000 passengers. The seating percentage 38.7%. Inbound flights carried in 13,200 passengers. The seating percentage was 25% of the total seat capacity. According to the latest technical standards, civil aviation organizations have a very strict requirement that passengers need to check in with the health QR codes. And there are 3 layers of temperature monitoring at the airport, from the airport check-in till the gates of the air flights. Besides, we've also regularly carried out disinfection and sanitation. The free air valve at the airport have been opened. Airliners and the airport used multiple ways to inform the passengers in advance so that the passengers will know in advance the policies of health prevention and control in their destinations. So this has been the update on the resumption of operation by Wuhan Airport. I'd like to thank guest speakers for taking questions. Tomorrow we will focus on the medicine and vaccine development. We will have Science and Technology Ministry, China Administration of Traditional Chinese Medicine, and CFDA officials to take questions. We look forward to your continuous attention, and we conclude today's press conference. Thank you.